Hi guys, I'm Luana.
I'm Bruna.
And I'm Sara.
And together we're going to present the work on thrombosis at the Federal Technological University of Paraná, together with Professor Katia Elisa Prus. And Sara will start by talking about what thrombosis is.
What is thrombosis? To explain what thrombosis is, I'll first talk about what a blood clot is. The blood clot is shown here. Here are the red obliques. Here's the nameplate, and here represents the rupture of the blood vessel wall. So when we suffer a cut, the platelets go towards the break in the wall, preventing our blood from flowing endlessly. After a while, the vessel is recanalized and circulation returns to normal. Thrombosis is a problem there. Mechanism, because a thrombus is generated without there being any bleeding. This prevents normal flow from the bloodstream. Thrombosis occurs in both veins and arteries. This is usually the case, happens in the circulatory system of the lower limbs. The biggest problem is when it happens. Pulmonary embolism, which is when this thrombus detaches from where it was formed, causing more serious consequences.
Before we start explaining thrombosis, it's important to learn a little more about the circulatory system, as this is essential for understanding thrombosis. Let's start by explaining the functional parts of the circulation. Here we have the arteries, which transport blood under high pressure to the tissues. Here we have the capillaries, which are the smallest units. Its main function is the exchange of substances. Here we have the veins, which act as conduits to transport blood back to the heart. Let's start by talking about the circulatory system and its function, which is to supply the needs of the body's tissues through the blood. For example, removing metabolic waste such as carbon dioxide and urea from the tissues and taking it to the excretory organs such as the lungs and kidneys. It also transports nutrients to the tissues such as oxygen, hormones, and other essential substances. In addition, the circulatory system helps maintain the body's pH and ideal temperature. Now, to better understand how the circulatory system works, there are two types of circulation, systemic and pulmonary. In the pulmonary circulation, it pumps venous blood, which is rich in carbon dioxide, into the lungs for gas exchange. In the systemic circulation, oxygen is transported in the blood, leaving the lungs, going to the heart, and then distributing it to the organs and all the tissues. Well, going back to the pulmonary circulation, venous blood starts pumping out of the tissues and into the right atrium, entering through the superior vena cava and the inferior vena cava. The blood is then pumped into the right ventricle and into the lungs, passing through the pulmonary trunk, which branches off into the left artery and the right artery. Once in the lungs, the capillaries carry out all the gas exchange, which is the release of carbon dioxide and the absorption of oxygen. This process is called hematosis. This oxygenated blood will leave the lungs and head towards the left atrium via the left pulmonary veins and the right pulmonary veins. From the left atrium, blood is pumped into the left ventricle, and from the left ventricle, the blood passes through the aorta, which branches off and distributes oxygenated blood to all the organs and tissues of the human body. Which carry out cellular respiration, where oxygen is captured and carbon dioxide is released. Subtitles by the Amara.org community.
So now we're going to talk about the types of thrombosis. We have venous thrombosis, arterial thrombosis, and thromboembolism. Now let's talk about the difference between them. Starting with arterial thrombosis. Arterial thrombosis is the formation of a thrombus that affects the arterial system, which is responsible for carrying blood from the heart to the organs and tissues. To understand this better, let's take a look at systemic circulation. The capillaries do all the gas exchange. This oxygenated blood leaves the lungs, is pumped by the heart, and distributed to the tissues, such as kidneys, muscles, livers, among others. The next is venous thrombosis. Venous thrombosis is the formation of a clot that compromises part of the pulmonary circulation. The pulmonary circulation carries blood that has already left the tissues with oxygen back to the heart, which will do the pumping and send it to the lungs, releasing carbon dioxide for a new oxygenation cycle. Finally, let's talk about thromboembolism. Thromboembolism, after the thrombus has already formed. It detaches either in the vein or artery and moves through the bloodstream, affecting other parts of the body. So, which parts of the body can the clot lodge in? We have the lungs, the brain, and the extremities of the body. Now let's start with the lungs, which is known as a pulmonary embolism, which is one of the most common and serious forms. In this case, a blood clot usually originates in the veins of the legs, known as DVT, deep vein thrombosis. It detaches and travels through the bloodstreams to the lungs, where they can obstruct a pulmonary artery. Now let's talk a little about the brain. So that you understand, I'm going to tell you a little bit about wolves. We have the occipital, parietal, frontal, and temporal lobes, the spinal cord, and the cerebellum. When a thrombus blocks a cerebral artery, this can result in brain damage due to a lack of oxygen and nutrients, causing strokes, for example. Finally, let's take a look at the extremities of the body, which is when peripheral ischemia occurs, which is a medical condition that occurs when there is a decrease in blood flow for all parts of the body, such as the legs and arms. This decrease in blood flow can be caused by an obstruction or narrowing of the arteries that supply blood to all regions. Symptoms of thrombosis. Now let's see what the symptoms are. A person with thrombosis will have swelling. It occurs in one of the legs and usually increases over time. Swelling is usually greater in venous thrombosis than in arterial thrombosis. Sudden pain in one of the legs that gradually becomes more intense. Redness in the affected leg. A feeling of warmth when touching the swollen leg. Dilation of the veins, making them more visible on the skin. Stiffer than normal skin in the area. Pain to the touch in the affected area. And fatigue. Thrombosis can also occur in the arm. Here is a representation of a thrombus developing. And then what happens with thrombosis? The swelling of the arm. The ways to prevent thrombosis are physical exercise, a balanced diet, no smoking, avoid drinking alcoholic beverages, maintaining your ideal weight, drink plenty of water, wear elastic stockings in case of venous insufficiency, always with medical advice. It helps with blood pumping and pain relief. During long journeys, wear comfortable clothes and shoes. And move your legs even when sitting down. For those who work for a long time sitting in the same position, it's important to move around or wear compression stockings. If you have a family history of thrombosis, or if you have any symptoms, make an appointment with your doctor. If the patient has already been diagnosed with thrombosis, they need to adhere to these habits even more to avoid the appearance of new thrombi. Means of treatment. The diagnosis is made by medical examination and complementary tests. The medical examination shows the signs described above, which may be present to a lesser or greater degree. The complementary tests, the Dedimer blood test, when negative, rule out the presence of acute thrombosis. And the ultrasound, duplex scan, showing the absence or reduction of flow in the vein studied, confirms the visual presence of the thrombus. After diagnosis, the initial measures for treatment are the immediate adoption of absolute rest and the use of anticoagulants. In more serious cases, thrombus removal may be necessary, using mechanical thrombectomy techniques or chemical fibrinolysis. Who is prone to thrombosis? One of the predisposing factors to thrombosis is age. Although thrombosis is common in people over 60, it can occur at any age. Other situations that predispose to thrombosis are prolonged period of bed rest, childbirth in the last 6 months, obesity, people who have had recent surgery, cancer patients, the use of tobacco, the use of contraceptives or hormone replacement, family history of thrombosis. In addition, genetic factors are one of the causes of thrombosis. The LIDA mutation is the main genetic factor behind the occurrence of deep vein thrombosis, followed by a mutation in the prothrombin gene. Deficiency in anticoagulants is also part of the predisposition to thrombosis.
According to the Unified Health System and the Brazilian Society of Angiology and Vascular Surgery. A survey of hospitalizations due to thrombosis was carried out, and, in addition, a ranking of the states where hospitalization due to thrombosis was made. Paraná is in third place with 44,000 people who received care between January 2012 and August 2023. In second place, we have Minas Gerais with 77,000 patients, and São Paulo in first place with 131,000 patients. Throughout Brazil, around 489,000 people have been treated. In the first 8 months of this year alone, around 165 patients in 2023. In 2019, it was the year with the most hospitalizations during the period analyzed. The total number of procedures exceeded the average of 126 patients. Conclusion. In short, thrombosis is a serious condition, which involves the formation of blood clots and can occur in different parts of the body. Presenting as arterial thrombosis, venous thrombosis, and thromboembolism, among other parts of the body. So understanding the risk factors, prevention methods, and treatment is crucial to dealing effectively. During our studies, we explored various factors that contribute to the development of thrombosis, including genetic predispositions, lifestyle, specific events such as surgery or prolonged immobilization. We also discussed potentially fatal complications such as pulmonary embolism, and cerebrovascular accident, better known as a stroke. As we advance in our knowledge of thrombosis, we are also faced with promising advances in the diagnosis and treatment of this condition. New therapeutic approaches such as coagulant agents offer hope of improving outcomes for patients. So here we have the National Day for Combating and Preventing Thrombosis, which takes place on September 16th. Knowledge about thrombosis is disseminated through public campaigns, community events, educational material, and online awareness programs. Subtitles by the Amara.org community.